Stephanie. I'm a registered nurse and I'll be discussing vitiligo, more specifically vitiligo halo nevi. With the help of my patient here, a mole assessment will be performed. In addition, the ABCDEs of melanoma will be discussed. So first, let's break down the words. So what is vitiligo? Vitiligo is a disorder of the melanocytes that produce melanin. They either stop functioning or they die. And what happens is it leaves white pigments or patches on the skin. A halo is a ring, a nevus is a mole, and nevi are moles, plural. So vitiligo halo nevi is a white ring that is surrounding a mole. So if we take a look at this picture on the second slide here, this is a picture of vitiligo halo nevus. So this is a picture of one of my moles. As you can see, there's a white ring that is surrounding the mole. So vitiligo halo nevi, it occurs in about 1% of the population, and the average age of onset is about 15 years of age. So what causes vitiligo? Well, they think there is an autoimmune component. So the body thinks that there is something wrong or something abnormal about a mole or moles, and it decides that it's going to attack the mole. So it will send out some lymphocytes, T lymphocytes, mostly cytotoxic cells, helper cells, and macrophages. And what these do is they are going to attack the pigment cells in the mole. So the mole will change color from brown to pink, and then eventually it will disappear. So we can look at the next slide. It might be hard to tell, but the mole is actually absent. It's gone. It has disappeared, and it left a white ring. So why does the white ring remain? Well, this is because when the body attacks a mole, it also attacks the normal skin that is surrounding the mole, and it leaves a white ring that doesn't have any pigment. Another cause of vitiligo can be sunburn. That can be a trigger. For example, a second or third degree burn, a burn with blistering, can potentially cause this. And also there may be a genetic component. So this is seen more frequently in patients with Turner syndrome. And about 20% of patients with vitiligo also have vitiligo halo nevi. Also, if there's a family history, if there's a person in the family who has vitiligo, vitiligo halo nevi, or some kind of autoimmune disease, the person will be more susceptible to getting vitiligo halo nevi. So what are the signs and symptoms of vitiligo halo nevi? Well, we have seen the moles and what they look like. Now these moles are predominantly on the trunk. You rarely will see them on the arms and the legs. And they also progress through 4 stages. So we'll take a look at those stages. So these are the 4 stages of vitiligo halo nevi. In the first stage, what happens is around the mole it forms a white ring. It's a very thin white ring. In the second stage, the ring enlarges. The white ring of depigmentation enlarges, and the mole becomes pink. It gets pinker or lighter. In the third stage, the mole is almost absent, and the white area of depigmentation remains. And then in the fourth stage, the skin is returning back to normal. Now, to get from the first stage to the fourth stage does not happen overnight. It can take about 10 years for this to happen. Also, the moles may not progress through all the stages. For example, some of my moles are stuck in stage 2 and some of them are stuck in stage 3. And that is where treatment comes into play. So how is vitiligo halo nevi diagnosed? First, a physician would want to rule out some of the other diagnoses, for example, malignant melanoma. Also, they would perform an examination of the central nevus and perform a skin biopsy. The skin biopsy would show a mononuclear infiltration with all those cells that I mentioned earlier. And for histology, in the area of depigmentation, it would show a decrease in the number of melanocytes, melanophages, and a decrease in the pigment of the keratinocytes. The treatment, there is no cure. Treatment is really not necessary, but it can be cosmetically disfiguring for the patient. Also, the areas of depigmentation, they are at risk for sunburn because they are lacking the protective melanin. So we want to encourage our patients to wear sunscreen, primarily an SPF of at least 30 or greater. They can also try makeup around the areas of depigmentation, but that's not always effective. Sometimes it doesn't cover it up. They could also get a prescription cream. The corticosteroids can be used, such as Topicort, forms of vitamin D, such as Dovanax, immunosuppressants such as Elidel and Protopic. So for example, my dermatologist recommended all three of them together or combined. So the Topicort, the Dovanex, and the Elidel. And they were minimally effective. They did allow some of the filling in of color. If none of those treatment works, you can try some light therapy. This is a narrowband UVB light. Typically, I'd go in about 3 times a week for several months. You can go to a dermatologist's office or you can go to an urgent care clinic for the after hours or the evening hours. Also, the nurse should teach the patient with vitiligo, halo, nevi how to perform a skin self-exam and encourage them to make annual visits to their dermatologist to measure for, or to observe for changes in the mole. So this brings us to the assessment portion. So when we do a skin assessment or a skin check on a patient, we do it on admission and then we do it once a week, typically after a patient's bath or shower. So when we are looking at a patient's skin, primarily the moles, we have to remember some areas to look. So you would have to get a comb and you would have to look at a patient's scalp. You would have them raise their arms, look at their sides. Also, you got to make sure you look under female's breast and make sure you look at the peri area of the buttocks and in between the buttocks. Now, when you're looking at the skin and you maybe see some examples of vitiligo, halo, nevi, you may think they look like melanoma, for example, because they're going through so many changes. But the mole inside the halo, we have to remember it is rarely malignant. Also, a single halo nevis it's really suspicious versus if you have many halo nevi. So how can we tell if a mole is benign, if it's a benign halo nevi, or if it shows signs of cancer? So physicians have developed what is called the ABCDEs of melanoma, and so we're going to go over those. So the first one that we have is the symmetry. So we want the mole to be round or oval. We don't want it to be asymmetric, but as you can see, asymmetry can occur in vitiligo, halo, nevis. So we are going to take a look at one of our patient's moles here. On his arm, you can zoom in if you can. So we're going to take a look at this mole. This mole, it isn't asymmetric, it's pretty symmetrical, so it's nothing suspicious. So now we'll go to the B part. B is for border, and we want it to have smooth edges, abnormal or edges that are uneven. Again, if you look at this patient's mole, it's going to be hard to tell, but his edges are uneven and they are sort of rough and jagged. They are not smooth, so this would be suspicious. The next one is color. We want our moles to be a consistent color, whether they are brown or light brown, and if there's any color variation, that would be suspicious. Again, you have to keep in mind with vitiligo, halo, nevi, they do go through color changes according to the stages. So they go from the brown to the pink and eventually disappear. With our patients here, it's not really a normal brown color, it's sort of a gray color, but it is one consistent color. The next one we have is diameter. Anything greater than 6 millimeters or greater than the size of a pencil eraser would be suspicious. So we're going to take a pencil eraser here, and our patient's mole is just the size of the eraser, so it isn't anything suspicious. Finally, we have evolving elevation and enlargement. So we're going to ask the patient if they notice any of their moles that have changed in size, shape, or color. And this patient said that this particular mole here has changed in color. It changed from a brown and now it is a gray, sort of a light gray color. We also need to ask the patient if they have any associated itching, burning, or bleeding with it. And the patient said that he did not have any of these symptoms. So those are the ABCDEs of melanoma, and with this patient, we would report these suspicious findings to the physician. A couple nursing diagnoses you can use for vitiligo, halo, nevi is a disturbed body image, a disturbed self-concept, and a disturbed self-esteem. Some of the interventions you could use are counseling, maybe refer them to a vitiligo support group, provide them patient education on the different treatments and some of the topical medications that they could use. So in conclusion, I have discussed vitiligo halo nevi and how to perform a mole assessment using the ABCDEs of melanoma.